Hi everyone, today I am giving you information on the topic cataract. This one is the cataract part 4, in which we will discuss about the IOL power calculation. So let's move to the quick review of what is cataract. So cataract is basically a clouding of lens in the eye that affects the vision. If you are noticing here that this one is the unoperated eye, okay, this one is the eye before cataract surgery. You are seeing here that this is a crystalline lens and it is whitish in color. Okay, as one person grows in age or as the person get older, there are the chances so that the normal or the natural crystalline lens gets opaque and which affects the vision. Okay, so we will remove the crystalline lens to regain the vision. This eye, if you are seeing here, then there is a removal of crystalline lens and we have placed the intraocular lens, which means we have placed the artificial lens. Okay, so this one is the post operative eye after the surgery. When we are looking on the slit lamp, then this image is seen, and this one is the presence of crystalline lens which we have placed during the cataract surgery. This was all about the basic. Now IOL power calculation, the lens which we have put inside the eye, how to calculate the power of that lens. Okay, that is the IOL power calculation. Power of intraocular lens is calculated by the different methods before cataract surgery and it is known as a biometry. Okay, power of intraocular lens. Intra means inside the eye, intra means inside, ocular means eye. Okay, the lens which we are supposed to be implant inside the eye is intraocular lens, and in short form we will say IOL. Okay, and its power is calculated by the different methods. Before doing the cataract surgery, we should know that what is the power of implanted intraocular lens which we are going to implant inside the surgery, and that process is known as a biometry. Okay, it is an artificial implant that is used to replace your natural lens in the eye. So IOL is the intraocular lens, which is an artificial lens which we are going to place inside the eye and replacing your natural lens which gets opaque by aging. So let's move. What are the methods? Now we have two methods to calculate the IOL power. First one is the by IOL Master, which is the automated method. Second one is the by immersion, which is manual. By IOL Master. An IOL Master uses a latest laser technology which is used to measure the length of the eye. Okay, the length of the eye is basically the axial length of the eye. Okay, so it is IOL Master is the latest as well as the laser technology which is used to measure the length of the eye. Measuring the length of the eye accurately extremely important in the cataract surgery. Okay, so what is the length of the eye, what is the length of the eyeball is very important while doing the cataract surgery, which allows the eye surgeon to select the right lens to implant for the each patient. Okay, which lens is suitable for the patient, it is very important to measure the length of the eye accurate. Okay, so let's see what is the procedure. Now the examination is performed using a biometer in a seated position and without a physical contact at the eye level. So the main advantage of the IOL Master is that there is no physical contact at the eye level. Okay, this one is the machine and this one is the sitting position of the patient. Okay, patient have to keep the chin rest at there and touch the forehead with this. Then the patient is supposed to look straight inside the machine and the examiner will take the measurement of the eye. It is very easy method as well as it is automated and there is no any touching or contact with the eye. With the chin set and the forehead leaning forward, the patient has to fix the gaze on the center light pattern inside the device without moving his eyes or the head. Okay, the patient is strictly instructed that he or she is not supposed to move the eye or the head while taking the measurement. Let's move to the next other parameters. Now in case of IOL Master, the main benefit is that we are supposed to take the IOL power, we will calculate the IOL power accurately, and it also gives another parameters, that is the axial length, corneal curvature, corneal thickness, anterior chamber depth, lens thickness and wide to wide distance. So let's see one by one what are these parameters. What is the axial length? Now axial length is defined as the length of the eyeball, which is very important while taking the measurement of the eye. Okay, so let's see that what is the axial length. Now axial length is the length of the eyeball which starts from the cornea and ends at the retina. This is the total or the overall length of the eyeball, which is very important while doing the biometry. Normal range of the axial length is 23.00 to 23.5 mm in males and 0.5 longer in females. Okay, so this one is the normal range. Myopia tends to occur with the axial length over 26 mm and dramatically increases the risk of vision problems in the adulthood. In case of myopia, those patients which have a high minus number, their axial length is over 26. More than 26, their axial length should be there. When the axial length increases, then the power of the IOL power get decreases. Okay, normal IOL power ranges from the plus 19 to plus 22. Okay, so their IOL power get decreases. As the minus number increases, the IOL power get decreases. So it will move to the plus 12, plus 10. As the minus number increases, the IOL power get decreases. Okay, so this is the vice versa, or we can say the reciprocal of the axial length. When axial length increases, then IOL power get decreases. Next one is the corneal curvature. Now it is basically the curve shape of the cornea. As we all know that what is cornea. Okay, this one is the cornea. It is a transparent part which is present here. It is known as cornea. Okay, so next one is the radius of curvature. The IOL Master also gives the information about this. From the center radius of curvature is 5 mm. Anterior means from the outside and the posterior means from inside. So anterior means this one is the anterior part. Okay, as it is a dome shaped. Okay, its shape is like that. This one is the interior part from the outside and this one is the posterior part. Okay, so their measurement is given. From the center it is 5 mm. From the anterior outside part which is seen easily, or the exposure part, that is 7.8 mm, and the posterior part is 6.5 mm. Next one, or the next parameter, is corneal thickness. Now that was the cornea, and what is the thickness? Its thickness is 0.5 to 0.6 mm periphery. Okay, so we have seen that the cornea is like this. Okay, central corneal thickness is 0.5 to 0.6 and the peripheral corneal thickness is 1 to 2 mm only. Okay, okay, let's move to the next. ACD. ACD is basically the anterior chamber depth. Anatomically, it represents the distance between the corneal endothelium and the anterior capsule of the crystalline lens. Means ACD is 2.74 mm. ACD stands for the anterior chamber depth. Okay, so it is the distance from the endothelium of the cornea. Okay, endothelium is there from here to the starting part of the lens. This one is the lens, this one is basically a cornea. Okay, this one is the iris, center part, pupil is there. Okay, and here the lens is there. So ACD is basically this one, from the distance from the inside of the cornea to the starting of the crystalline lens. This is basically anterior chamber depth. Okay, and mean ACD is 2.74 mm. Let's move to the next, white to white distance. WTW stands for the white to white distance. Okay, it is basically the horizontal as well as vertical diameter of the cornea. Okay, that was the cornea which I have shown here. So it's vertical as well as horizontal diameter. Okay, minimum it should be 10.5 and to maximum it is 13.60. That is known as a white to white distance. Okay, it's vertical as well as horizontal diameter of the cornea is known as white to white. This one is the cornea. Okay, so it's vertical as well as horizontal if we look in a 3D position. Next one, keratometry values. Again, the keratometry values as well as the axial length, both are very important for calculating the biometry. Only two things are there. Okay, These values is the measurement of both vertical and horizontal meridian in diopters. Okay, so it will give the flat meridian and the steep meridian. K1 is the vertical. Okay, vertical meridian it will give, so it is in the range of 41.75 to 43.75. okay, basically it is 41 and 42 in the normal case. And we will also get the idea about the cylindrical value which we are supposed to provide to the patient. Okay, or after doing the cataract surgery what cylindrical value will be given, it gives the basic idea of that if the cornea is clear. Now always the vertical or the K1 is always greater, is always smaller, and K2 is always greater. For example, K1 is a flat meridian. Okay, it is a vertical as well as flat, which is 41.75, and horizontal means steep. Okay, which is 43.75. It gives the cylindrical value. Okay, how to calculate the cylindrical value from it? It is 41 and it is 43. When we will subtract 43 from 41, then it will gives the 2 cylindrical value. Okay, this was the keratometry values which give the horizontal as well as vertical meridian of the cornea in diopters. Okay, next one, limitations of IOL Master. Now, as IOL Master can do the biometry, calculate the IOL power very accurately, but it also have the limitations, as well as it also gives a lot of values to us in addition. For example, CCT, corneal thickness, K1, K2, keratometry values, anterior chamber depth, but it also have the limitations in the patients with the media opacity such as corneal opacity. If a patient has the corneal opacity, dense cataract means highly developed cataract or the mature cataract, posterior polar cataract, it cannot measure the axial length. Okay, so axial length is not measured by the IOL Master. In case of highly matured cataract, post polar cataract, without calculating the axial length, we are not supposed to calculate the IOL power which we are going to implant after the cataract surgery or during the cataract surgery. In case of vitreous hemorrhage, axial length cannot be measured. Okay, this one is the another limitation of the IOL Master. Next one is difficulty in measuring axial length in infants, because there is proper positioning. Patient have to keep the chin rest there, touch the forehead, and continues looking while taking the measurement. So it is very difficult in case of infants. In the newborn babies, as we have also seen that the congenital cataract takes place in the newborns, small children, and the mentally disabled patient, because it is very difficult to explain the mentally disabled patient to focus at what we are saying. Okay, so these are the limitations of the IOL Master. Thanks for your patience listening. This was the end.